In this playlist of Let's Crack NPTE National Physical Therapy Exam, we will discuss next 10 MCQs. The MCQs number 1, a football player who complained of burning pain in the supraclavicular area that radiate down to the arm is diagnosed with grade 2 peripheral nerve injury. Remember this, grade 2 peripheral nerve injuries. Grade 2 is classified as axonotmesis. Grade 2 is classified as axonotmesis. Which of the following accurately describe axonotmesis? We will tell what is axonotmesis, what are the symptoms in it. It involves axonal damage, axon damage and Valerian degeneration. The Schwann cell sheet is intact. Here is the Schwann sheet is intact, axonal damage and Valerian degeneration. This is the correct option and discuss this. Axonotmesis involve axonal damage and Valerian degeneration while the sheet is folding structure is intact. In this type of injury, the internal structure is preserved. So in this case, recovery is still achievable. Option B refer to the grade 1 nerve injury. Option B is the grade 1 nerve injury. It involves nerve function disruption due to demyelination. The axonal integrity is intact. Option B is the characteristics of neuropraxia. It is the grade 1. Neuropraxia is grade 1. Axonotmesis is grade 2 and the grade 3 is neurotmesis. Option C refer to the grade 3 nerve injury. What is in the option C? It involves axonal and myelin sheath damage. The nerve damage is permanent. Here the recovery has no chance. Option B, we have a still recovery. This is the grade 2. Option B is the grade 1 characteristics and it is the grade 3. Note them. Next, we will discuss the MCQs number 2. A patient demonstrate loss of muscle strength in all four extremities. In all four extremities due to spinal cord injury. Remember this, all four extremity involved. Which of the following is accurately derived from the following? Due to involvement of all four extremities, the injury involved one of these cervical spinal nerves. This is very severity of the condition when involving cervical spinal nerves. Discuss this. A patient with tetraplegia in which all the four quadrants involved most likely has an injury affected the cervical spine. In addition to paralysis of the four extremities, the abdominal muscles also affected, causes weakness in the breathing and inability to cough effectively. An injury involving a thoracic region. If the thoracic region involved, it causes paraplegia, paralysis of both the lower limbs. Note them. Go to the next MCQs. MCQs number 3. A 25-year-old female gave birth to a male newborn with Talip's equinovarus involving the right foot. In most cases of clubfoot deformity, which of the following is most commonly involved? In case of clubfoot, ankle joint involved. Ankle is the most commonly involved in clubfoot deformity. Ankle is composed of 7 tarsal bones. There are 7 tarsal bones forming a group of bones called tarsus. What are their names? It consists of talus, calcaneus, navicular, cuboid, intermediate, medial and lateral cuneiform. These are the 7 tarsal bones. Next we have MCQs number 4. The brain cell consists of 3 areas, 3 components. All of you know: midbrain, medulla oblongata and pons. Medulla oblongata is composed of all the afferent and efferent tract. Efferent is go to the for action and the afferent from the efferent it go to the through the afferent to the brain. It is also the center for various physiological mechanisms. All of the following are controlled by the medulla oblongata except which is not the function of medulla oblongata: visual reflex. Visual reflex is controlled by midbrain. Note this, visual reflex is controlled by Midbrain, option A, B, and C are controlled by medulla oblongata. Blood pressure, blood vessel diameter, breathing, and swelling is controlled by medulla oblongata. Breathing is also assisted by the pons. Sneezing, vomiting, and heart rate are also controlled by medulla oblongata. Kindly note this. Next, we have MCQs number 5. Which are the following in the lower extremity allow adduction of the hip joint? Except which is not involved in the hip adduction, that is the gluteus medius. Gluteus medius in the hip internal rotator. Adductor magnus, pectineus, and gracilis are hip abductors. To test for the strength of hip adductors, if you want to test the strength of hip adductors, therapist ask a patient to lie on a right side with the lower extremity and the lumbar spine straight. Therapist hold the upper leg in abduction and ask the patient to extremity upward from the table without flexing, rotating, and extending. If he can do it, then the hip adductors are strengthened. So in this case, option C is correct, which is not hip adductor. This is the gluteus medius. Next, we have MCQs number 6. Movement during ambulation are the result of various factors, including those produced by muscles. Muscles are essential for acceleration, deceleration, and shock absorption. Which of the following is true about muscle involving with gait mechanics? Which of the following muscle is true about gait mechanics, gait kinetics? This is the correct option. The greater amount of muscle activity is required during the first 10% of this trance phase and the last 10% of the swing phase. First 10% of the trance and the last 10% of the swing phase. The greater amount of muscle activity occur during the first 10% of trance and last 10% of swing phase. Inactivity occur during the mid trance and the swing phase. Based on the information, locomotion does not require continuous muscle activity. In case of locomotion, there is not the continuous muscle activity, while in case of acceleration there is a muscle concentric activity, muscle contract, while in case of deceleration there is a muscle eccentric activity, muscle lengthen. The greatest amount of muscle activity occur during acceleration and deceleration. Note this. MCQs number 7. Obturator nerve present on the adductors. The large nerve formed from the anterior root of the lumbar plexus provides sensory innervation to the skin and fascia over the distal two-thirds of the thigh. This peripheral nerve is derived from the following nerve roots: obturator nerve, accept. Obturator nerve is the nerve root value L3, L2, L3, and L4, which is not L1. Obturator nerve is not derived from L1, it is derived from L2, L3, and L4. When any of these nerve root is compressed, irritation of obturator nerve may occur. Next, we have MCQs number 8. Anterior deltoid originate from lateral margin and superior surface of acromion. It insert into the deltoid tuberosity. Everyone knows deltoid tuberosity of the humerus. Which of the following is correct action of anterior fibers of deltoid? It flex the glenohumeral joint and rotate the spine medially. It flex the humerus shoulder joint and rotate the spine medially. Discuss this answer. The anterior deltoid flex the GH joint and rotate the spine medially. Option A is the action of latissimus dorsi. What is option A? It medially rotate, adduct, and extend the GH joint, shoulder joint. It is the correct option for latissimus dorsi. Option B is the action of subscapularis. It stabilizes the head of the humerus in the glenoid fossa. Stabilization is the action of subscapularis. Option C is the action of biceps. It flexes the shoulder joint. It is the action of biceps. This is very important. Note this. Next, MCQs number 9. The mechanism of recovery after a stroke has come in two stages. First stage of recovery occur within first 3 to 6 months. The second stage occur after this time period. Okay, which of the following changes are expected within first 3 to 6 months after a stroke? The correct option is recovery of partially injured neurons. This is our the changes that we are expected within the first 3 to 6 months. Recovery of partially injured neurons become recovered in this period. Recovery of partially injured ischemic neurons occur within the first 3 to 6 months after a stroke. Ischemia means when there is reduced blood oxygen. Resolution of local edema, augmentation of local circulation, and destruction of local toxin are expected within first 6 months of stroke. The second stage of recovery involve, note this, neuroplasticity, which includes changes of structural and functional neuron organization. Neuroplasticity is occurring in the second stage of recovery. Next, the MCQs number 10. MCQs number 9. The patient who complain of fatigue, difficulty, swelling, and weakness is diagnosed with the myasthenia gravis. Who has a complaint of fatigue, difficulty, swelling, and weakness is the symptoms of myasthenia gravis. This physical therapist who is teaching the patient with various conservation methods understand that this condition is most likely caused by which of the following? Myasthenia gravis, everyone knows, it is due to the insufficient secretion of acetylcholine receptors. Acetylcholine chemical in insufficient secretion of acetylcholine. Myasthenia gravis is caused by insufficient secretion of acetylcholine, which causes a defect in the transmission of signals and myoneural junction. At the neuromuscular junction, there is a defect, and this causes the myasthenia gravis. Parkinson disease is caused by insufficient secretion of dopamine, causing dysfunction of the extrapyramidal system, which can cause tremors, bradykinesia, postural instability, ataxia. These are the symptoms of Parkinson. The cause of multiple sclerosis, MS, is unknown, but its development is thought to be influenced by the autoimmune disease. This is the myasthenia. Multiple sclerosis is the autoimmune disease. It is caused by the demyelination of the neuron. The neuron sheet is demyelinated. Note this. This is the MCQs number 10. Last MCQs. A distant runner has a transient mean temporary episode of complete motor paralysis, motor weakness with minimal sensory involvement in the left lower extremity. The patient history include a recent compartment syndrome injury, which is believed to be strongly associated with patient symptoms at concert. The patient acute nerve injury is most likely caused by which of the following mechanism? In the compartment syndrome, we see crush and percussion injury. Compartment syndrome is a crush and percussion injury. What happened in the compartment syndrome? In the compartment syndrome, injury causes increased pressure in the surrounding tissue due to any cause, due to tourniquet, tight bandage on the forearm. It can cause increased pressure and the blood flow decrease. This pressure compresses the supply of arterial blood of the nerves, increasing the nerve risk for ischemic cell damage. When there is blood flow reduced, this can cause ischemia. An example of mechanical injury is tourniquet paralysis. Stretch injuries may be caused by severe blow to the nerve or any kind of traction. These are kind of stretch injuries. Mechanical injuries due to corset, tourniquet, and there are stretch injuries due to the blow to the nerve and traction. An example of penetrating trauma is a stab wound laceration. If there is a sharp cut, this can cause causes of compartment syndrome. I think, I hope so. This lecture is very important and I told you everything in very simple explanation. We completed 20 MCQs of our most important playlist. I hope so you like this video, and if you have any question you can ask. Thank you.